Hello everyone, welcome to Shanxi University of Chinese Medicine. Today, we will go on our study of moxibustion. Last time, we learned the content about what is moxibustion, the functions and classification of moxibustion. Today, we will learn manipulation and application of indirect moxibustion. Indirect moxibustion, 间接灸. This method, also known as moxibustion with material insulation. So, there is no direct contact between the cone and the skin. Various materials are used for insulation. Generally, those most common medicinal substances used are ginger, salt, garlic, and monkshood cake. Let's introduce them one by one. The first is ginger moxibustion, 隔姜灸. Manipulation. Fresh ginger is cut into slices, each about 2 to 3 centimeters wide and 0.2 to 0.3 centimeters thick. Several needle holes are punched into the slices. Then, ginger slice is placed on the acupoints or areas selected. The moxa cone is then placed on top of the ginger slice, where it is ignited and burned when the cone has been burned completely. The ash is removed. It is replaced with another one, and the procedure is repeated until all the cones required are finished. Usually, the local skin in the area being treated will become flushed, which is the desired effect. This method can warm the spleen and the stomach to stop vomiting and disperse cold to relieve pain. Thus, it is indicated for symptoms related to cold, such as vomiting, abdominal pain, joint pain, and so on. The second one is garlic moxibustion, 隔蒜灸. Garlic cloves are cut into slices, each about 0.2 to 0.3 centimeters thick. Then, holes are punched into them. Sometimes garlic mash may also be used. Then, the garlic is placed on the acupoints or areas selected and moxa cones are ignited and burned on top of them, as described above. This method effectively eliminates heat and toxins, and it is also useful for killing parasites, so it is often used to treat sacroiliac tuberculosis and the early stages of skin ulcer and local swellings. It can clear away the heat evil or detoxify and has a pesticidal function. The third is salt moxibustion, 隔盐灸. This method is also known as 神阙 moxibustion, 神阙 CV8, as it is usually done on the umbilicus. First, the umbilicus is filled with salt to the level of the skin. Then, place a large-sized moxa cone on top of the salt, or a slice of ginger. Then, the moxa cone is ignited and burnt. When consumed, the ash is removed, and it is replaced with another until all the cones required have been consumed. since this method is effective for restoring young collapse. It is used for treating in and cold disorders, vomiting and diarrhea, and flaccid type wound stroke. For example, when treating flaccid type wound stroke, continuously moxibustion is applied until the patient's vital signs are steady. That is, his or her pulse can be palpated and the extremities have become warm. The fourth is monk's hood cake moxibustion, 隔父子饼灸. A cake of monk's hood is approximately 3 centimeters in diameter and 0.3 centimeters in thickness, and it is made of monk's hood mixed with alcohol. It is punched with several holes and placed on the affected area, where moxa cones are placed on top of it to be ignited and burnt. This method is useful for warming and strengthening the kidney young, and thus it is adopted to treat impotence, supernatriuria, premature ejaculation, infertility, and ruptured abscesses resistant to healing. Order of moxibustion. On this subject, explicit directions were given by the ancestors. 千金药方针灸 recorded. Moxibustion ought to be conducted on the yang aspect first, followed by the yin and the upper air first, and then the lower. 明堂九经 also points out moxibustion should be applied to the points on the upper portion before that on the lower. The number of moxa cones should be small first, and second larger. Clinically, we should start moxibustion from upper part of the body to the lower part. First, yang aspect, then the yin aspect of the body. Initially, a small number of moxa cones should be applied with additional treatment over a period of time. Larger ones can be used. However, in special circumstances, these rules can be modified to coincide with the patient's conditions. Reinforcing and reducing with moxibustion. In 灵枢背书, it says, for reinforcement, do not assist combustion by blowing. Let moxa cone burn naturally till it burns out. For reduction, blow air to it time after time to make the combustion vigorous. That is the detailed record for reinforcement and reduction with moxibustion from ancient peoples. Besides, in practice, moxibustion can be conducted according to the patient's condition and the properties of the acute points. Moxibustion contraindications. We should know the following principles. A patient with excess heat syndromes or with fevers due to yin deficiency are contraindicated for moxibustion. Scoring moxibustion is prohibited on the face and head, and areas close to large blood vessels. Moxibustion is prohibited on the abdomen and the lumbosacral areas during pregnancy. Precautions should be taken with patients suffering from skin allergies or ulcers. Okay, this brings to the end of today's lecture. See you next time.